Hello, my name is Rosie. I'm one of the chemotherapy nurses from Velindre Cancer Centre. This presentation is to give you an overview of chemotherapy treatment and to help to answer some of the questions you may have about treatment. Firstly, before we start talking about the chemotherapy, it's important that you know that we are here to support you. Alongside our many colleagues from the charitable sector, as you can see here, there are many people who are there to help you. This presentation will concentrate on telling you about the chemotherapy, its side effects and how to stay safe. But if you want to know more about the support services that are available to you, this next slide will show you the contact details of our supportive care team at Velindre Cancer Centre, who can refer you on and give you advice. So, what is chemotherapy? Chemotherapy is the use of drugs to destroy cancer cells. It works by killing cells which are in the process of growing. It affects cells which are growing constantly, such as the cancer cells in your body, because they are ordinary cells which have gone wrong and are growing out of control. Unfortunately, the chemotherapy cannot tell the difference between a cancer cell that's growing and an ordinary cell that's growing. So therefore, many of the side effects of chemotherapy are related to the fact that it affects your body cells which are in the process of growing. For example, we know that our hair is constantly growing, and hair is an area that is often affected by your chemotherapy treatment. However, it is important to note that not all chemotherapy treatment will make your hair fall out. You will be given further information about your specific treatment, and it will be made clear to you whether your treatment is one of the ones that will make your hair fall out. Any hair that is lost through chemotherapy will grow back. So how is chemotherapy given? It's given in a variety of different ways. Most commonly, it's given into a vein using a drip. It can be given by mouth as tablets, or it can be given by using a small portable pump which you take home with you. Or it may be that you are given a combination of all of these. These are some pictures showing you chemotherapy being given in a drip. You can see a couple of things in these pictures which are useful. When you're being given the chemotherapy in a drip, it will be going through an infusion pump on a wheel stand. Now that infusion pump will regulate the speed at which the chemotherapy goes through, and you will be attached to it throughout your treatment. It can be unplugged for you to walk it out to the toilet, and the nurses are there at all times to give you a hand if you need it. If you are given chemotherapy in a drip, then this may be given through a cannula or drip needle in your hand or arm, or it may be given through what we call a PICC line, which is placed in your upper arm and stays in for the whole course of your treatment. Again, your team will talk to you about which is the best route for you to have your chemotherapy treatment. The most important thing is that during the chemotherapy treatment, the veins should feel comfortable as the chemotherapy is being given. If it does feel at all uncomfortable, it is very important that you tell one of the nurses who will be in the treatment area with you at any time. These are some common questions which people have asked us, and we'll address those first before we talk a little bit more about some of the side effects. Firstly, people often want to know how often will the chemotherapy be given. Now, as mentioned previously, every treatment may be a little different, and you will be given a separate information leaflet. If you haven't had specific information about the treatment that you will be having, please make sure that you ask us or visit the Velindre Cancer website to look for the information sheet. In there, it will clearly tell you how often your treatment will be given. It may be every 2 weeks, every 3 weeks, or it may involve taking tablets every day. Another frustration for so many patients is wanting to know why they have so many appointments. Well, particularly at the beginning of treatment, there are a number of things that need to be done in order to make sure that we have carried out all the appropriate tests, to make sure that it's safe to proceed with treatment, and that we've had enough opportunity to speak to you, to give you a chance to talk through the options of treatment and ask any questions. Once you get settled into the routine of treatment, you will find that the number of appointments will drop. And usually you will have one appointment which is a clinic visit, or this may now be a phone call, which will assess how you are to make sure that all is going well with your treatment, and to arrange for you to have some blood tests to check that your blood counts have recovered from your last treatment, so that we know it's safe to prescribe your chemotherapy treatment for your next treatment appointment, which is usually a couple of days after that clinic review. How will I feel on the day of treatment? Well, obviously everybody will be different, and you may feel slightly anxious, but what we do not expect you to do is to suddenly feel unwell. If you suddenly feel unwell as the treatment is being given to you, that may mean you are having a very unusual reaction to the drug. There are some drugs which can cause allergic type reactions, and if that's the case, we will make sure that we tell you and you know what to watch out for. But because you've never had this treatment before, we don't know how you're going to react. So if you do suddenly feel unwell, do tell one of the nurses straight away. Should you eat and take normal medicines on the day of treatment? The answer to that is yes. When the medical team discuss with you what normal medications they take, if there's anything there that they're concerned about that will clash with the chemotherapy, they should have already discussed it with you. So unless you've been told to change, you should continue to take your normal medication, whether that's blood pressure tablets or painkillers, as you would do normally. Otherwise, you may find that those things are not under control when you come and spend the day with us on the day unit. And again, in the same way, you should have something to eat before you come. We generally would advise that you just have a light meal rather than something very heavy, but it's better to come having had something to eat. What about alcohol? You do need to be cautious with alcohol, because alcohol is something that needs to be processed by the body, and we are going to be giving you some strong chemotherapy drugs which the body also needs to process, especially through the liver. So therefore we would generally advise that you should, if possible, avoid drinking alcohol the day before your treatment and for the first few days after treatment if you're having treatment in a drip. Other than that, unless you've been told you should not drink alcohol for any other health reason, it may be okay to have things in moderation. Dyeing your hair. You need to be careful with dyeing your hair, simply because this may also damage your hair, which, as we've already discussed, may be prone to having damage due to the chemotherapy. If you are having a chemotherapy that doesn't cause you to lose your hair, you may still find it is weakened. So we would definitely advise you to be very cautious, possibly take advice from your hairdresser, or if you do want to dye your hair, to use plant-based, gentle hair dyes and not ones that contain ammonia. Can I drive? Well, on the day of treatment, particularly your first treatment, we would often advise you not to drive yourself home, simply because you don't quite know how you're going to be. But once you've had your first treatment, you may well find that you feel fine to drive yourself to and from appointments. In between treatments, if you do feel tired, if you are affected by that and you aren't able to concentrate, then obviously we would advise you not to drive. There are just one or two exceptions, one particular treatment in which we would generally advise you not to drive because of some of the immediate side effects, but if that applies to you, we will make sure that you know that. So what if you were unwell on the day that you were due to come to us for a clinic or a treatment appointment? It's really important that if you are unwell, have developed new symptoms, that you don't come to the hospital, but phone us first on the number here and ask the treatment helpline. We'll talk a little bit more about that helpline number later. But particularly if you're unwell with something which could be contagious, you should not come to the hospital until you phoned us first. It might be that we still want to see you, but then we might arrange for you to be seen in a separate place away from other patients. Now we're going to talk about chemotherapy side effects. These do depend on the type of chemotherapy treatment that you're having, But there are some side effects which are common to most chemotherapy treatments, and it is those that we will concentrate on talking about in this presentation. Hopefully you should already have been given some written information about the chemotherapy, and when you read through those, it can feel a bit daunting because we do have to tell you about the range of side effects that can potentially happen in order that you know how to look after yourself and to reduce the impact of those side effects, but also most importantly that you know at what stage you need to contact us if they're not under control. However, please remember that you will not get all of the side effects listed. And of those that do happen, usually they are easy to manage and follow a predictable pattern so that we can then help you to cope with them. For example, we know that many chemotherapy drugs can make you feel sick. And because we know this, we will give you anti-sickness medicine, so our aim is that you won't be sick at all. When you arrive for your treatment on the day unit, one of the first things that we will do is to give you the anti-sickness medicine. This will ensure that this is working before the chemotherapy has a chance to make you feel sick. And any sickness that's related to chemotherapy will usually only happen for the first 2 to 3 days following a chemotherapy drip. If you're having chemotherapy tablets, things are a little bit more different, and usually they don't cause as many problems with sickness. It is important that you do take the anti-sickness tablets as prescribed for that first few days after the treatment in order to prevent the sickness from happening. If you do find they're not working, please give us a ring on the number that you will be given. It helps to explain how we can predict how you may feel at certain stages during your treatment. So before your first chemotherapy treatment, you will have some blood samples taken. So at the first red arrow there, you can see we are expecting your blood count to be at a nice high level. When we give the chemotherapy treatment, then the chemotherapy affects the number of blood cells in your body because they are, as we described earlier, a group of cells which are constantly growing and therefore are very susceptible to the chemotherapy treatment. So over the time between the first and the second chemotherapy, the blood count levels will drop down to a point generally about halfway between the treatments at a low point, and then it will begin to pick back up again. And in some respects, that dip can describe how you may feel. The first few days after chemotherapy, providing that you're not actually having a lot of problems with sickness and we've got that under control, you may actually feel quite well. And you may not, you may think that the side effects of chemotherapy are not going to affect you. However, after a few more days, you may find that you begin to feel a bit more tired and a bit more run down, and you may have a few days before your blood count begins to pick back up again when you're feeling quite washed out, and that's very normal. However, that pattern obviously is different for everybody. Some people, blood count will drop a lot lower, or it may do it a bit later. So immediately before your second treatment, a few days before, we will generally check your blood count again to make sure that your blood count has recovered from treatment. Now, it is possible that that blood count won't have got back up to a safe level in order to give your next treatment. So if that happens, we may have to put your treatment off for a week to allow the blood count to recover. If that happens for you, we will discuss this with you. Now, we talked about chemotherapy affecting your blood cells. Specifically, there are 3 main types of blood cells, and they are all affected in different ways by the chemotherapy. If you have a low red cell count, this is what we call anemia. If that happens, you may look very pale and feel more tired, may potentially be a little bit short of breath. If we find that you are anemic and have a low red cell count, we may talk to you about having a blood transfusion. Certainly not everybody does, but this may happen to you. If your platelet count is low, this may cause an increased risk of bruising and bleeding because your platelets are responsible for helping your blood to clot. Now, it is actually very unusual for your platelet count to be so low that it gives you any problems, but it's good to know about it because if you do notice any unusual bruising or bleeding, for example, bleeding from your gums, that is not usual for you, then it's very important that you watch out for that so you can tell us about it. You may also have a low white cell count, and this is the one that we worry about the most because your white cells are part of your immune system and they help you to fight off infection. So with a low white cell count, you have a reduced ability to fight off infection. It does not mean that you will catch an infection, but if you do catch any sort of infection, you are much more susceptible to it and you can become very seriously ill very quickly. So that's what we call sepsis. Sepsis is when you have an overwhelming infection that your body cannot fight off. And when you're going through chemotherapy treatment, you are much more susceptible to having sepsis. We have an informative video, which is only 5 minutes long, which you can access from this link on the screen. And we highly recommend that you watch this video because this will help you to identify what sepsis is, what you need to look out for, how you can prevent it, and what to do if you do develop any problems. Now, in particular, at the moment, we are concerned about your exposure to the virus COVID-19. It is again very important that you reduce your risk as far as possible of being exposed to COVID-19. This is important to protect both you, other patients that you come into contact with when you come to the hospital, and the staff members who are looking after you. So we would advise that throughout your treatment, that wherever possible, you should try to maintain social distancing and try to reduce the number of people you keep in contact with. You should follow strict hand washing. We will ask you to wear a mask when you come to the day unit for your treatment. And please, again, do not come to the hospital if you or a close contact of yours has any symptoms of COVID-19 or you feel unwell. Phone us on the number that we will give you instead. In addition, it would be really helpful if you could arrive as close as possible to your appointment time. This will reduce bottlenecks and enable us to make sure that the waiting areas and treatment areas are not too crowded and we can maintain social distancing between patients. When you arrive for treatment, please wait until you're seen by a staff member before entering the unit. We will make sure that we've checked your temperature and you'll be asked about any symptoms you may have. You will be given a mask to wear. We also ask you to check your temperature, if you have a thermometer, before you leave the house to make sure that it isn't above the level of 37.5. And if that's the case, again, don't come to the hospital, but give us a ring. Now, what we will do to reduce your risk of being exposed to COVID-19 is to use phone clinics to try to reduce time that you have to spend in the hospital wherever it is possible to do. We also will follow strict hand washing and cleaning protocols to protect you. We will be wearing personal protective equipment and we will ensure that social distancing between treatment chairs is maintained. We ask that no visitors should come to the chemotherapy day units. This is because otherwise it will not be possible to maintain the distance between you and somebody else. This is a picture of showing you what our chemotherapy day unit looks like. As you can see, the space between chairs to enable the social distancing to occur. And the staff members are wearing the equipment to protect themselves and you in the day unit. Now, the chemotherapy alert card you will be given when you attend for your first chemotherapy treatment. It's really important that you carry this with you at all times. This alert card you should show to any healthcare professional treating you, whether that's your GP or if you were admitted to another hospital as an emergency. It has your 24-hour contact number for the treatment helpline. It's got key details about the name of your treatment, which can help other healthcare professionals if they need to know what treatment you're on. And it has a reminder for you of the key side effects that you must watch out for and the ones that you should phone us about. It has the 24-hour contact number on it, and remember, this is the 24-hour number that you should use if you are unwell at any time during your chemotherapy or for up to 6 weeks afterwards. You phone the number on the card and ask for the treatment helpline. Now, when you get through to the treatment helpline, it is a triage service, and you may well speak to one of our call handlers who will ask you a series of questions to assess your symptoms. They will then get advice from one of our nurses or doctors who may be able to give you advice over the phone. They may refer you on to your GP, or they may arrange for you to come into hospital, either here or in your local hospital. One of the other things that is a significant risk when you're having chemotherapy treatment is the risk of blood clots. Having cancer and chemotherapy treatment does increase your risk of developing blood clots, sometimes known as a deep vein thrombosis. Key things to look out for are any pain, redness and swelling, particularly in your leg, in the back of your calf, or it may occasionally happen in your arm. If those things happen, it's really important that you let us know and phone the treatment helpline on that number on your alert card so that we can advise you. Because these clots, if they move from your arm or your leg, can move to your heart or your lungs and may cause very serious life-threatening side effects. We're now going to talk a little bit about some of the other common side effects that can occur with chemotherapy. We mentioned sickness earlier, and the very first thing that's on here is to make sure that you take the anti-sickness tablets that we give you as prescribed. It's really important. If you do that, our aim is that you won't be sick at all. But sometimes people may just have a background feeling of sickness, even if they aren't actually being sick. And these are some useful tips that patients have mentioned to us that they may have found helpful during those few days when they may feel a little bit more nauseated. So, for example, eating small and frequent meals rather than large meals may be easier to manage. Some people find cold food better than hot simply because there's not so much smell associated with it. Avoiding things like fried and fatty foods which sit heavily on your stomach. Ideally, if you can get someone else to prepare your food, that means you may feel more like eating it because you aren't tired out from doing the cooking. Things like ginger or peppermint can really help just to settle the nausea, whether that's just sucking on a peppermint or having a ginger tea. They can be known to help. It is also really important that you drink plenty to try to flush through the chemotherapy drugs that we're giving you, but we do advise you to sip the drink slowly, particularly if you're feeling a bit sicky, because you may find that otherwise it sits very heavily on your stomach if you drink a whole glassful down straight in one go. Now, importantly, if you are a diabetic, it's very important to monitor your blood sugars, because sometimes some of the anti-sickness tablets we give you contain steroids which may affect your blood sugars, and so it's important that you keep a close eye on those during your time when you're going through chemotherapy. Most importantly, if you are actually vomiting, being sick, or you're unable to eat and drink because of feeling so terribly sick, then you should phone the treatment helpline now. Don't wait, give us a ring immediately. Now, diarrhea is something that can happen as a side effect of some of the chemotherapy treatments that we give. If you are having one of those chemotherapy treatments, it will be pointed out to you in your individual patient information leaflet. But the other thing that can cause diarrhea is that you may have some sort of infection. Whichever is the cause, diarrhea can result in dehydration and weakness if it is left untreated, so it's important not to ignore it. If you do have 4 or more bowel movements in 24 hours above what's normal for you, or it becomes much more watery, then please do phone the treatment helpline now. Don't ignore it. Phone us anytime, day or night, and we'll be able to assess you and advise. The lining of the mouth is an area which is very susceptible to damage from chemotherapy because, again, it's another area where the cells are growing rapidly. So in order to prevent getting problems in the mouth, we advise you to keep your mouth especially clean and moist to avoid infections, to brush your teeth and gums carefully after every meal. One of the ideal ways of doing this is to use an electric toothbrush if you've got one, because that regulates the pressure that's put onto your gums. Careful cleaning of dentures, And if you have any urgent dental work that needs doing, ideally this should be done before starting your chemotherapy treatment. And you definitely should not have any dental work during chemotherapy unless you first discussed it with the Velindre team, because of the additional risk of infection and bleeding whilst you're going through chemotherapy. Now, as long as you look after your mouth, we're hoping that you won't experience this, but if you do have some really nasty mouth ulcers, which make your mouth so sore and it becomes difficult to eat or drink, please phone the treatment helpline and we'll be able to advise you. Finally, tiredness. This is something that almost all patients going through chemotherapy will experience to a certain extent. The key thing is that it usually follows a pattern, as you saw from the little graph earlier. But because that's different for everybody, we often advise you to keep a diary so that then you can work out which are your good days and which are your bad days. So then you can help to take control and plan activities for those good days or times in the day which you find are easier. Because as you go through the treatment, you will find that it will fit a pattern each time. Ideally, you should try to balance some activity with rest, because actually it's been shown that getting out and about, even if it's just for a brief walk, is good for you both physically and psychologically. But you should set realistic goals. If you're normally a marathon runner, you may want to cut it down to a few miles a day. If all you ever do is walk to the post box and back, don't take up marathon running. And don't be afraid to ask for help. You'll find at this time that any friends and family are often wanting to know what they can do for help, so don't be afraid to ask for help if you're finding it difficult to do things and you may need some additional help at this time. So, there's a lot of information and you can go back through this presentation again if you need to at any time. Do remember that if you are unwell, do phone the treatment helpline with the number that's on your alert card any time, day or night. Don't wait until the next day. Please phone us, because on the whole, things that we know about early, we can treat early and keep you at home. And things that are ignored become much more difficult to treat. If you do have an emergency though, such as having central chest pain, severe shortness of breath or severe bleeding, don't phone our helpline. We're not an A&E hospital. Do phone 999, but show them your alert card so they know that you're on chemotherapy. If it is more than 6 weeks since you completed your chemotherapy and you are unwell, please don't phone the treatment helpline, because at this stage it should not be treatment related. So therefore phone your GP or see your pharmacist as you would have normally done before you started your chemotherapy. If you just have a general query, you may find it helpful just to check your chemotherapy leaflets first, and you may find the answer there. Or you may find that it directs you to phone us, and in which case, please do. Remember, with your treatment helpline number, we're never going to be cross if you phone us. It's never too much trouble. Please do phone us if you are unwell. Thank you for listening.